What's up, guys? This is the BJJ Restoration Body Project. This is Michael Coe. This is Michael Coe's knee. Michael Coe's knee also went to physical therapy school back in 2004. So here's a thing. I'm pretty stupid. If any of you guys know me, I'm not really smart. I just got through school because of hard work and a lot of good work ethic because I'm Asian. However, the reason I'm saying that is because when I looked at that poll, I looked at it a little too late. When I looked at it again, it was more updated. So the number one thing that most people are training with is knee pain. So that's the reason why you're looking at my knee. So I did shoulder last time. Today I'm going to do knee. So regardless of what knee issue you have have a meniscal tear, a ACL tear, a partial tear. You can have patellar tendonitis, IT band syndrome. There's Pez-Anserine bursitis would be in this inside part. Patellar tendon, quad tendon tendonitis. There's a lot of tendinitises, a lot of itises you can have in the knee. Regardless of what your issue is, if I were to treat someone's knee, the first thing oftentimes I look at, just to make sure that things are moving the way they're supposed to, is how well the kneecap moves. All right, so regardless of what knee issue you have, check if your kneecap moves. So I'm going to show you something you can do at home to try to see, one, does your kneecap move, and two, what can you do to improve it? All right, so my thing here is I have my leg relaxed here. I want to see how well this kneecap can move down, up, side to side. All right, so if I'm going to check side to side, I'm going to use my thumb in this case here, and I'm going to glide it to the side. I want to see how well that moves. So you got to fully relax your leg, especially your quad. So if you're looking at your anatomy, your quadricep comes from your hip all the way down to your knee, turns into about white stuff right around here, as in it turns into muscle tendon, red meat to white tendons, and then envelops and wraps around this kneecap. Once it gets around the kneecap, it narrows down and then goes into what we call the tibial tuberosity. So from here and down, it's all white. We call this part the quad tendon. We call this part the patellar tendon, but it's all one tendon that just goes there. It's just a geographical term. They're not two separate tendons that you work on. All right, but I want to see how well this kneecap can move. So again, I'm going to go move this knee to the side and relax leg. Okay. I'm going to go the other way. All right, so that kneecap moves pretty decent side to side. All right, I'm also going to move down, and I'm going to pull it up. Okay, so that is relaxed state here. I'm going to push it down, and I'm going to pull it up. All right. So all in all, my kneecap moves pretty decently. If I'm going to choose one direction moves the least, it's this way, but I don't expect you guys to be able to diagnose that necessarily. So my suggestion is to go in that forward direction position, left, right, down and up. I want you to pull it out to the side and just oscillate back and forth. Now you don't want to yank as hard as you can. Just go to the point where you feel some tension and just oscillate back and forth. Back and forth. So I'm going to push this way here. Back and forth, okay? Here, if you can see, this is where my resting position is. I'm gonna pull up, that's pulling up here, pushing down. Now remember, when I pull up, it's a little bit more difficult because the kneecap is wider here, we call this the base, and then it narrows down into a triangle to this point right through here. So when you have a large base you can push against when you want to push down. Up here, it's tiny points, like a pyramid. So just watch out, your finger's gonna slip around a lot with that. So just go to the end point and then just rock back and forth. Go to the end point, rock back and forth. All right, and do that in down, up, left to right. You can check both knees. Now if you guys are trained at the UFC gym La Mirada and you're interested about this video, what I tend to do if I'm going to treat a patient, I'm going to do that test back and forth, see how much motion there is. So for instance, for me, I'm going to say, hey, I might not move very well. This is actually already moving better. I might not be able to move very well outside, or we call lateral, right? So I might move that around, but then I might add another direction. I might see, hey, does it not move down or does it not move up very well? For me, it's a little bit more down. There's what we call end field doesn't move as much. So I might focus my time to see if I can get that direction to move and then the kneecap to move. Then afterwards, I want to see how well this patellar tendon moves, and there's a lot of other stuff that I'll do here. But if you're at the UFC Gym La Mirada and you see this video and you're concerned about your knee and how well your kneecap moves, ask me. I'll do a super quick 3-second assessment to see, hey, which direction moves the least and which direction that would benefit you the most from what direction. Because I can spend a minute going down, up, left, and right, but what if I were to spend 4 minutes in this one direction? That would get the most bang for your buck. So I would suggest you check that out. What's up, Juan? Thanks for joining. I know you caught the end, but thanks for watching this video here. All right, so if anyone has knee pain, check it out. All right, check out this video, check it out. Ask me questions if you see me in the gym. If you have any questions, don't be afraid to comment below, whether it be about the knee or if you have any other issues. Please share this to your friends who also do jiu-jitsu as information for them to be able to use to hopefully make sure that they don't injure themselves in the future. All right, guys? So share the BJJ Body Restoration Project page to all your friends on Facebook, and I will see you guys soon. Thanks.